My name is Dr. Tlaleng Mofokeng, and I'm the founder of Nalane for Reproductive Justice, which is a civil society organization that works specifically around sexual and reproductive health and rights. And many people always ask, what is SRHR? What are these rights that you are always talking about and advocating for? Sexual and reproductive health rights speak specifically to the rights of all human beings to be who they are. All genders, sexualities, wherever you are in the world, your race, it doesn't matter what class you are. At the end of the day, we believe that autonomy, which is the right to make decisions on your body in terms of dignified care and services, we're always advocating for access to quality healthcare services, inclusive of reproductive health, because often reproductive health, everyone takes it like as if it's an added extra, but it's important. And so sexual and reproductive health rights speak to the protection and the realization of those rights in literal terms, which means if you are a young woman in South Africa who needs access to contraception, what we're advocating for is that your rights to be on quality contraception is important, your right to accessing clinics that are nearby where you live is very important, and when you do get to the clinic, you have a right to be treated with dignity and to be respected for being a young woman who needs contraceptive. And in those instances, unfortunately, where it happens that people's rights are not protected or people are not able to access services, we always advocate for accountability for all the stakeholders, leadership people, people who are in positions of power, whether it's a clinic manager or facility manager, to ensure that when things go wrong, people, specifically young women who need services, are not delayed. Unfortunately, we know of stockouts where some clinics have continuous stockouts of very critical, sexual and reproductive health services. And what we are saying is that this should not happen at all. And in my line of work, I work to assist young people in terms of comprehensive sexuality education, which is an important part of SRHR, because if you don't know what your rights are, you can't fight for them for yourself. You can't be your own advocate. But also, if you don't know how your body works, what is menstruation, what does pregnancy symptoms look like, what do I do if I don't want to be pregnant anymore, it means then you can't make those decisions for yourself.